News of childbirth brings happiness and joy in our marriages and relationships. However, it can be so devastating for a couple to fail to get a child, or what some people call the fruit of the womb. And in most times, surprisingly, people will blame the woman for this calamity, which may not be completely true, because even the other gender can be infertile. In this video, we would like to look at what infertility is, what causes it, and what you can do to get rid of infertility. We have some questions here. One from Shita P to Mia N. She says, "Thank you, Doc. I'm in a relationship from June, but till now, no signs of pregnancy, and I want to have a baby." Another one is saying, "Doc, good day. I had a premature birth in November 2016, and I have not been able to conceive. But early this year, January to be precise, I got pregnant, but somehow miscarried. This is the 9th month, yet nothing. I could be expecting my menses later, but it comes as a surprise like 5 days earlier. So it's sad. It makes me depressed. Please, what can I do? I just have a son and I want twins." Another one is Oluwandimolia Onasanya. Is saying, "Please help me, doctor. I have been married for about 8 months and been expecting fruits of the womb, but all in vain. What will I do?" I'll have another question saying, "Doctor, please, I always go close to my husband while I'm unsafe for the past 3 years, but still I have not been able to conceive. So please help me because I'm worried. Thank you." Someone, Evelyn Ngesa, she says, "Thank you, Doc. I am in a long-distance relationship and I need a baby. Thanks." And lastly, Cynthia Ochanya Okoli says, "I have been married for 2 years and trying for a baby. I did HSG to flush my tubes in June, though my husband and I live apart due to jobs. I want to know exactly what to do to take in, and I guess my period may be coming today. I'm quite desperate to have children. My family has twins and I'm born after twins. What could I do?" All these, there are several of them floating questions about childbirth. They want to see how they can get the fruit of the womb.
Ask Dr. Othman on Sawa Wall.
Welcome to Ask Dr. Othman YouTube channel. This is your channel where you learn medicine at the comfort of your living room. You've been wanting to know how you can get in touch with me privately, and I have brought for you something very new. That is our website, www.drothman.com. Log into that website, book an appointment. We shall be in touch. You'll get a live chat with me where we shall discuss your matters privately and with a high level of confidentiality. So visit us on our website, ask any question of choice. I will be right there to answer you. Today we are talking about infertility. And in several episodes, we shall be discussing the whole topic of infertility. Let's first understand what infertility is. Infertility is a condition whereby you fail to get pregnant when you are staying with your partner, having sexual intercourse unprotected for at least 3 times in a week for a period of 1 year. What do I mean here? I received several questions like the ones we've seen previously, people asking about infertility. You know, I met my partner last month, but up to now, I'm not getting pregnant. I met my partner 2 months ago. I am not getting pregnant. And someone will tell you, you know, I meet my partner once in a year, but I'm not getting pregnant. Doctor, I'm so worried. That may not be infertility. That may not suit the definition of infertility. So for you to say that I am infertile or someone is infertile, we must satisfy these 3 conditions. Number 1, you must be meeting your partner at least 3 times in a week. Number 2, when you meet, you must be having live or unprotected sexual intercourse. And the third one is that the 2 conditions above should stay for a period of 1 year. If it's less than 1 year, we may not call it infertility. However, if it's 6 months, we can call it subfertility. And therefore, when you reach 6 months and you're not getting pregnant, then you can start on with the investigations, though we shall not confirm that you are infertile. Therefore, my viewers, infertility, you must satisfy the 3 conditions, and that is unprotected sexual intercourse at least 3 times in a week for a period of 1 year. So, what causes infertility? Infertility is not only for women, and this is where the public goes wrong. Most people think when someone is not giving birth, when the family is not getting a child, the whole family, all the relatives will gang against a woman, especially in our African culture. They will gang against that woman. They can chase her from her marriage because she's not getting pregnant. Actually, in my own language, they will say, Oyo Mugumba. And this is very bad. Infertility can be caused by 2 factors, the male factors and the female factors. In this first episode, we would like to look at generally how infertility comes about in women. Let's look at this diagram of the reproductive system of a woman. So this is the V plus V. I guess you all know this. This is the cervix. This is the womb or the uterus. Fallopian tubes, or what some people call the oviduct. This is the ovary, and these are the ova. So this is the reproductive system of a woman. And for you to understand infertility, you must first of all understand this system. Each of these parts, the parts of reproductive system, has its own function. It has a role it plays as far as reproduction and childbirth is concerned. Let's start with the V plus V. I guess everyone understands the role of this, and I know most of you would want to enjoy. This is the part you enjoy most. But the most important reason as to why we have this part for reproduction is that it stores, it receives the sperms. Once you have sexual intercourse, the sperms are received from this part. This part, the V, has a conducive environment, and I guess you know it's acidic in nature. So this condition is conducive for the survival of sperms in this area. Now we have another part, which is the cervix. This cervix is a narrow path that leads comes from the V plus V into the uterus. Number 1 of its role is to allow the sperms to pass through and enter into the uterus. And number 2 is that when someone conceives, when you get pregnant, this cervix closes so that the baby doesn't pass through, or to stop a miscarriage or an abortion. And also, when it's time for someone to give birth or for parturition, the cervix will open for the baby to get out. Then next we got the womb or the uterus. This is the area where also, number 1, the sperms pass. They swim through this area when they are going to the fallopian tubes. And also, this part acts as an implantation site. What do I mean? When the baby comes, it implants here, and the baby grows from this area. Then another part is the fallopian tube. This fallopian tube, or what some people call the oviduct, is the area where fertilization occurs. And then lastly are the ovary and the ova. These are the eggs. This is the area where the eggs are. So what happens for fertilization to occur? And before we even look at that, when you look at this structure, this is what makes reproduction go on smoothly. However, there are some other factors or some other structures that are invisible. There are structures you're not seeing here, but they are also part and parcel with reproduction. What are those factors? We have the hormones and the brain. Take an example that this is a vehicle. This is a vehicle. This is just a structure of the vehicle, the body of the vehicle. That vehicle cannot move unless there is fuel for those that use use fuel, and or there is a driver for those that use drivers. So, if this vehicle is not having a driver or fuel, it will never move. And the same applies to this structure of ours. You cannot conceive when the the hormones and the brain are not in place. So what happens? We have the brain, who is the driver. What it is going to do is to send a signal. The signal being sent is the fuel, and that is the hormone. It will tell the hormone, for example, a hormone called follicle stimulating hormone. It will be sent to the ovaries, telling the ovaries to manufacture or to cause maturation or to make one of the eggs or two of the eggs to mature, to grow very fast. And that is the follicle stimulating hormone. It is the fuel. The other one that's sent is the brain. So when the hormone grows very fast and it matures, then the brain will also command, it will also send another signal, and that is the luteinizing hormone, to cause the egg to move. So what will happen is that this egg will move and it will reach this point. The egg will move and reach this point. So this point is called the ampulla. This point is the ampulla and is found in the fallopian tube. So what has happened, like I've explained, the brain, using its pituitary gland, will send a signal to the ovaries to make or to mature one of the eggs. It will again send another signal, that is the luteinizing hormone, again to the ovary, and it will order one of the eggs or two of them or any number to move into the fallopian tube. And therefore, it will come and stage at this particular area. Once it stages there, this is the time we say the woman is ovulating. And actually, I've had stories of women telling me that they even feel some pain when this egg is moving. And it may be true because there are some people that receive ovulatory pains. So this egg has moved on to this area, which is the ampulla. Now what is going to happen? You are going to have sexual intercourse. You are having your sexual intercourse today. You're having sexual intercourse and the sperms are deposited here. So sperms will now swim through the cervix. They will reach into the uterus. They will swim, and one of them will fertilize this egg. So once fertilization has occurred, the next step is going to be formation of a zygote. That is the baby. So the baby is going to be formed from this area. After the baby is being formed at this place called the ampulla, it's going to be propelled, or it is going to be moved back into the uterus. So once the baby is moved back into the uterus, this is the baby. This is our baby. It will now have implantation. We shall have implantation. Implantation is the attachment. This baby will attach itself, or will adhere, will attach itself onto the walls of the uterus. So the baby will keep in the uterus. What this uterus will do is, number one, to feed, to provide nourishment, blood and so on to this fetus so that it can grow. Secondly, this uterus is also expansive. As the more the baby grows, the uterus will allow it, will also expand so that the baby can keep there. That's why women will have those front humps. They'll have big bellies because the uterus is expanding as the baby grows. Now, Mr. Brain also will send a signal here, and it will send another hormone called progesterone. Progesterone is what we call the hormone of pregnancy. It is a hormone that babysits. It is the person that babysits this fetus while still in the womb. It keeps on telling this fetus, please don't cry, don't get sick, please remain there, don't get out. It is this progesterone. Therefore, progesterone is going to keep this baby in the uterus. And now, I told you this is a vehicle. So we are moving. Most people know that people deliver at the 9th month. So we have a destination. Our vehicle is moving because there is a baby, everything is okay, the driver is there, the fuel is there. So what is going to happen is that when we reach where we are going, when we reach our destination, what the driver does is to put the leg off the accelerator and then press the brakes. So what the brain is going to do is also to remove its feet from the accelerator, and that is to withdraw slowly this progesterone. Because I told you progesterone is the hormone that keeps this baby into the uterus. Therefore, when you remove it, it means the baby will get out. But the baby is already grown. The baby wants to get out. Therefore, the brain will take away progesterone slowly, and it will now bring other two hormones. That is the brake. Which hormone? It will bring oxytocin. It will bring a hormone called oxytocin. Another hormone called prolactin. Mark those hormones. Oxytocin and prolactin. What prolactin does, it will go to your breasts, the boobs, and then it will start secreting the breast milk. Because the brain is aware that, hey, we are about to give birth. The baby will need what? Breast milk. Therefore, prolactin will start secreting milk. We start manufacturing food for this baby because the baby is no longer going to be feeding through the uterus. Another hormone which is secreted at the last time during labor is the oxytocin. What it will do is now, one, to open the cervix, to dilate the cervix so that the baby can pass through. Secondly, is to cause contractions. That is what we call the labor pains. The labor pains have to be caused here so that the baby can get out. And therefore, that is how someone will give birth. That is exactly what happens for you to give birth. This is the normal system. Therefore, what will cause infertility is any abnormality. An abnormality onto any of these points. There can be an abnormality here, 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 all the brain and all the fuel, that is, those are the hormones. So which abnormalities can occur? In this episode, we are looking generally at what causes infertility, and in other episodes, we shall look at each of them and the solution we can have. So, if the V, if your V is not conducive enough, for example, if it's not acidic enough, it is highly alkaline, maybe because of some other conditions we shall look at in the next video. Of course, every sperm that will be deposited here will be killed, will die off. It will not even reach the level of the cervix, and therefore someone will not be conceiving. Your V is not conducive for the sperms. Number two, the cervix. Especially for those who have a lot of miscarriages. Every pregnancy you get, it is miscarriage. 2 months, I'm getting an abortion. 3 months, it's a miscarriage. 3 months, I was pregnant, I am now bleeding. The cervix. What is happening to the cervix? It opens anyhow, uncontrollably. The cervix is loose. It is not thick enough. It is not long enough. The cervix is, in our language, you call it injabayaba. It's incompetent, that cervix. And therefore, the babies will just get out. Another factor, the uterus, the womb. There are some people with a uterus which is slippery. It is too thick. When the sperms come, they cannot swim. The environment is not good for the sperms to swim through. The uterus is infected. It is having endometritis. It is infected, inflamed. The uterus is sick. The uterus has masses, or what we call masses, swellings like fibroids, cancers. This uterus cannot be able to propel, to allow the sperms to pass through to go the fallopian tubes. Again, even if the sperms find their way of going through the fallopian tubes, the fertilization occurs, the baby will not implant. The baby will come, but it doesn't have where to attach itself. And therefore, it will be a miscarriage. Actually, there are some people who get miscarriages after just 1 week of conception. And this may not be noticed because there may not be bleeding. There may not be bleeding. There is fertilization that has taken place, but implantation has not occurred. It's like someone who takes emergency contraceptive pills. They will stop implantation from occurring, but you not see any bleeding because it's not a real abortion. So problems of the uterus can cause someone not to conceive. Another problem can be the fallopian tubes. The fallopian tubes may be blocked. There is blockade of the fallopian tubes. So what is going to happen? When the egg comes, it cannot pass through. When the sperms come, they cannot reach the egg. How will fertilization occur? Infertility. Another issue, there may be adhesions. What we call adhesions, they are like scars in the fallopian tube. The egg is not able to pass through the fallopian tube very well. The sperms, when they reach the fallopian tubes, they just stop somewhere there because the edges are rugged. They cannot swim very well. Even if they manage to swim, and this is very dangerous when you have adhesions and all scars in the tube. If the sperm manages to enter here and fertilization occurs, remember after forming a zygote, the zygote has to pass through and comes to the uterus. If this edge is not smooth enough, there is no, the proprietary action is not very good, then this fetus will remain in the tube and thus people get ectopic pregnancies. They told me, my baby is in the tubes. And that is a baby that cannot survive beyond 3 months. It will have to be aborted. The procedure has to be done and the baby gets removed. All those are causes of infertility. Another issue can be on the ovary and ovaries. You may find you don't have ovaries. You don't have an ovary. You don't have, the ovary is there, but there are no eggs. Naturally, it happened like that. You are born like that. So you cannot conceive without the ovary or without the ova. And another factor can be the other structures we are not seeing. We talked about the hormones or the fuel. Your hormones may have a problem. You don't have, the levels are low. You have less fuel. You know when you're driving a car and the fuel gauge shows you red. You cannot go anymore. The levels are very low. My brothers who use motorcycles, sometimes they bend the motorcycles to get some fuel. So this can also happen here. Your levels of hormones are low. The follicle-stimulating hormone is low. Therefore, the eggs are not matured. Another thing, luteinizing hormone is not there. Therefore, ovulation doesn't occur. The eggs are mature. Everything is mature, but the egg does not move to the fallopian tube. And remember, this sperm will not swim until it reaches the ovary. It can't. It will swim, it will come here, nothing. There is no egg. It will go back. Or it will die off. Someone is not getting pregnant. All those can be the problems. And lastly, the problem that can happen is the brain. The brain has a problem. We have in the brain, the main structure in the brain is called the pituitary gland. If you have a problem with the pituitary gland, a pituitary gland can have a tumor, can have very many diseases. And if it has a problem, it will not make those orders. It will not send signals to the hormones. If the driver is sick, the vehicle will not move properly, even if it's an automatic vehicle. It will not move because still there is a need for someone to press a button. Even if the vehicle is computerized, still there is a need for a person to press a button, stop, move, reverse, and so on. And therefore, the person will not be able to conceive. For this episode, let us stop here on understanding this. In the next episode, we shall be looking at each of the causes, and we shall also be looking at how you can treat each of them so that you can have a baby. Log into our website www.druothman.com, ask any question privately, have a private chat with me. We shall discuss more, and please, I assure you of privacy and confidentiality. Thank you very much for watching Ask Dr. Othman YouTube channel. Find us on all our social media platforms. Ask any question of your choice. And those of you who want to ask privately, you know where to go. I sign out.
Ask Dr. Othman omusawo wo.